Good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for November 15th, 2023. My name is Julia Gruss, and I am your webinar facilitator for today. I am a research project specialist at KU's Center for Public Partnerships and Research, and I am joined today by my CPPR colleague, Erica Figueroa, who will be taking care of all of our Zoom logistics. And remember that any relevant links that you see on your screen in our webinar slides will be placed in the chat throughout the presentation. And any questions that you might have will also be monitored through the chat as well. First, I'm going to give you some quick updates before I introduce this month's presenter. First off, we have our webinar cadence moving forward into 2024, as we are very close to that, which is crazy. The year has gone by so quickly. But as we move into 2024, our webinars will be held on every second Wednesday of the month, making it a little easier for everyone, so you know exactly when those meetings are going to be each month on the second Wednesday. So following this meeting, I will be extending our current webinar series and sending out a confirmation email to all of our current webinar registrants. So following this meeting, just be on the lookout from an email that will come from Zoom, and it will have the subject line KS Early Childhood Systems Building Webinar 2024 confirmation. This should give you the ability to use a link to add the entirety of our 2024 webinar series to your work calendars. As always, don't forget to sign up for our All In for Kansas Kids weekly e-newsletter so you can stay up to date on everything childcare in Kansas. You can do so by going to www.kschildrenscabinet.org. All right, we will move on to our presenter. Today we have Cora Ungerer of the Kansas Department of Health and Environment. She will be discussing consumer and family partnerships in Kansas, touching on our Family Advisory Council, our Family Leadership Team, and the Family and Consumer Partnership Toolkit. And then directly following Cora's presentation, I will also be giving you a few more early childhood systems updates. But without further ado, Cora, you can take over.
All right, thank you. And I guess good afternoon. It's just past noon now. My name is Cora Ungerer, and I am the Family and Consumer Partnership Program Coordinator at KDHE. And I'm going to talk to you about our Family and Consumer Partnership Program. All right, so I would like to start today by sharing what our official definition for family and consumer partnership is. This was adopted from the Maternal and Child Health Block Grant Guidance. In short, we believe that families and consumers should be active partners in all levels of our systems. This means that they are partners in their care, education, community access, and the services and supports that they receive. It also means that they are active partners in planning, developing, and evaluating those programs and services that they work with. They are They are active partners in advocacy and policy needs, and this can be done when we intentionally plan for this kind of partnership. All right, you can go to the next slide. So this is for a guiding principle of the Kansas Title V maternal and child health work, which is consumer engagement, ultimately assuring that families and consumers have a voice and that it's central to our programming, initiatives, and special projects. The last Title V needs assessment established new priorities that will go through the end of 2025. One of those priorities, which is priority 7, is around assuring that there are strength-based supports and services available to promote healthy families and relationships. So we cannot do that. Oh, no, you can go back. Thank you. We cannot do that without the partnership of families that we are working to support. Our objectives within this priority are focused on increasing engagement across programs with our grantees and existing partnerships and other external partnerships, increasing opportunities for families to be supported, empowered, and equipping family leaders to be involved in the work, and expanding access to quality and holistic care coordination that can wrap around a family when and where they need it. So that we can provide quality and timely supports, building on family strengths and create a space for families to thrive. Now you can progress. Thank you. So this is one of our mantras, which is to engage families at all levels. We have adopted and we also agree to the 4 levels of engagement that the Association of Maternal and Child Health Programs, or AMCHIP, has developed. So starting with level 1, it's about basic input like satisfaction or engagement surveys. Then moving up, it's opportunities for families to utilize their personal experience and advise programs on things that impact their personal situations. If you move up to advisory systems, that will be for opportunities for families to advocate and impact broader systems level work that will affect more than just their own services or for their own family. And lastly, this one brings in that they are supporting that we are, and they are becoming leaders and advocate partners in this work, thinking about like the programming and policy and program culture. So you can move on to the next slide. So often we talk about family and consumer engagement, but what we have learned here over the years is that this work, or in this work, is that our parents and families want partnership more than engagement. They want broad engagement at all levels, input through surveys, focus groups, advisory councils, which are all great, but it's how we engage and how we utilize their input that results in true partnership. So partnership in our work is about a mindset and planning. It's about intentionality, and it's about taking engagement to the next level. All right. So I'm going to give you a brief overview of what our program is. The Family and Consumer Partnership Program is made up of 4 parts. We have peer supports, leadership, advocacy, and technical assistance. This program was officially established in 2020, but this is work that we have been doing for far longer than that. But we wanted to make this more of an intentional practice. So for peer supports, we have our Supporting You, which is a peer-to-peer support network that our advisory council helped us. Well, really, they drove the project to developing it, and then we have the caregiver resource website, which we partner with Lend to maintain and oversee. In leadership, we have a Title V delegate program that is through AMCHIP. It's a new program that is being developed out to provide opportunities for families across Kansas to represent the state and the families throughout the state. We will be developing, not all of these programs are fully fledged yet because this is still a newer program with lots going on. So the Alumni Mentorship and Policy Program is something that we have coming up on the horizon that still needs to be fully developed, but that is one of our goals to help increase leadership with families throughout the state. In advisory, we have our expanded Family Advisory Council, which also started looking at expansion in 2020, and I will talk more about that after this slide. And then we have the Preschool Development Grant Family Leadership Team, which I will also talk more about. Under technical assistance, we have our Family and Consumer Engagement Toolkit, and something that will be coming up on the horizon, the MCH Change Academy. That name might be changing, but it's going to help for people who work in the fields that the Maternal and Child Health Block Grant supports, help people learn about our systems, either inside the program or outside the program. We're creating different tracks. So you can wait to hear more about that in the future. All right, we can go on. Yes, so as you can tell, we really have a nothing about us without us mindset. And this is another one of our mantras that is across the program and the work regularly. So the new Bureau of Family Health Family Advisory Council, previously the Special Health Services Family Advisory Council. So this focuses a lot on that priority 7 that I mentioned earlier. Since 2009, we have had a family advisory council. That council really focused on families who had children with special healthcare needs. And throughout its time in developing, all the way from just bringing people together and sharing our updates and letting them leave, to creating a fully working council where the council members got to pick projects and what things that they wanted to advance. We were able to see the value in partnering with those families and the value that their voices and experiences brought to the table. That council had space for up to 12 members and was fairly small. The members were across the state. But during 2020, with the experience of seeing how valuable they were and with the leadership here in the Bureau of Family Health, we set out to expand the FAC to have work groups in each of the 5 core MCH domains. And now in 2023, we have 38 amazing members that serve on our council, and we have room for more. All right, we can go on. So as I mentioned, it was developed in 2020. We started recruiting in 2021, and we officially started our work groups in 2022. So that was January 2022. Each of our work groups, which are the women maternal, early childhood, birth to age 5, child ages 6 to 11, adolescents. On the slide, it says 12 to 21, but really we tend to say 12 and up. And then the children with special healthcare need work group still maintains as well. In 2022, what they do is they look at our state action plan, and it's broken down into different categories of population, such as we have our council broken out into, and they will pick something that they feel like resonates with them that they would like to help move forward. I threw our vision up on there. I really feel like that helps to emphasize how much we believe in partnering and working alongside the families that live throughout the state and that are involved in our programs. So right now, we do have space. This was at last head count. We do have a goal to have 7 to 11 members per work group. And we do want members who live across the state. So that's urban and rural. That's people with different experiences. We're really trying to capture a little bit of everything, and that is so hard to do. But we keep trying, and it's great that we have room. We try to be understanding and supporting of our members if they would like to move to a different work group, or if life just gets too busy and they can't continue to serve. We've had a lot of turnover because, as I'm sure everybody knows, when you have children, life happens, life gets crazy, it gets super busy, and sometimes they thought they had the time and something comes up and they no longer do. But we still love all of our members. All right. So we meet 4 times a year with this council. We meet in January, April, July, and October. 2 of those meetings right now are virtual, and 2 of them are in person. Our virtual is a little different. They're shorter days. And when I say right now, it's because we like to listen to our families to make sure what we're doing still works for them. So not too frequently, but not infrequently. If someone brings up a point saying, it would be really nice if this is the way our meetings were structured, then we can talk to the members in the group and see if that would work for the majority as well. And we'll shift times. At one point, our virtual meetings were 9:30 to 2:30, and That's a long day on Zoom. I'm sure you can imagine. Um, anyway, so it's listening, it's evaluating where we are and how we meet. When we have our in-person meetings, at this moment, we like to move around the state so no one has to travel too far. So if you're coming from Southwest Kansas, you don't have to drive like 5 hours to get somewhere every meeting. But we also have only just returned back to in-person meetings. Last October was our first one. So we're 3 meetings into back to in-person. And while it's great, it's, you know, it's different than virtual, which has been great. So for our members, we do try to provide as much support as possible and help them feel appreciated and help them feel like they have the ability to come and participate in those meetings in a meaningful way. So we do provide them a stipend for attending. We also have the opportunity that they can apply for like a childcare stipend if they need one to help find care for even the virtual meetings, virtual and in person, just so they're able to fully engage. If we have an in-person meeting and they have to drive and it's further, we can, if it's 150 miles or more, we can provide a hotel room for them, or we feed them, of course, and we also reimburse for mileage at the state rate as well as reimburse for tolls. So there's a lot of little parts there in trying to support our members and make it worthwhile for them and to show our appreciation for them coming and taking their time to be with us. Oh, something I forgot to mention on our meetings is that our meetings are always on a Saturday. So when you look at those times that are listed there, I did not write that up there, but our meetings are always on Saturdays, so families who work have more of an opportunity to engage with us. Um, thank you. So as mentioned, they do review our Title V state action plan and they go through their priorities that are affiliated with the work group that they are in. And they help provide ideas and feedback. They help us to advise on the priorities that we put in there as well. When we do our yearly block grant review, they are given the opportunity to be some of the family reviewers and encouraged to do so and to take like an active partnership role in that. So we love hearing what life is like in their communities, how we can better improve it, or things that are going really well in the services that we provide so that we can see how we can duplicate that throughout the state if possible. Once they pick their projects, once they pick their projects that each work group is sitting on, that project can really be anything from giving us a formal recommendation on something to creating some sort of a product like a brochure or a pamphlet or a website, or helping assist in work that is already happening here in the agency or with programs that we partner with or support. So that idea of a project is really broad and it's up to them to drive that. We try to scale it back and make it realistic because while we love all of our families, everyone wants to change the world and make everything better. And sometimes you have to take a few steps back to take, that first step into improving or helping to improve the systems that support families. All right, you can move on. So we do have plans to continue to grow. I know we have grown a lot in the last couple of years, but we are looking at and having a lot of discussions around adding in a youth advisory, either partnering with another group to help support that or how we could make that work. We would love to bring that voice in from youth themselves and get their perspective on how we can best support them rather than just their parents. And then we are also looking at bringing in a fatherhood work group. While anyone can apply to the council, it is overwhelmingly women that apply. We have, throughout the history of the council, had men on the council, but it's not as much as we would like. And so we are looking at ways that we can bring in more men to help advise as well with their experiences. All right. So next I'm going to talk about our Family and Consumer Partnership Toolkit. So this was developed in part, a huge part, with conversations with our Family Advisory Council, and that was in that 2021 expansion gap year. For about half that year, once we had a good amount of new members, we wanted to feel like we were progressing towards something while we were waiting to fill those spaces, so that each of those work groups could have that 7 to 11 membership and feel like they were feeling pretty good about starting on their projects. So we engaged in a series of roundtable discussions where we gathered a lot of feedback from them on topics that we wanted to know about. We also took information from other states and resources nationally, as well as national frameworks. And then, of course, our own experiences and the historical knowledge that we have over the past from engaging with families. This document is available on the Kansas MCH website, which I can show you on the next slide. So this is on the toolkit page, but if you go to the Kansas MCH website, and then you go down to the Family Advisory tab, if you go forward, yeah. And then down there at the bottom, you can go forward again. Thank you. That is where you will find it. So it's under Family Advisory Council, and then all the way down at the bottom is the Family and Consumer Partnership Toolkit. And that's where it's living right now. If you click that little icon that is off to the side that shows like the document, you get access to the PDF version. On the website, we are adding in like tools in one sheet, like info sheets that you can actively engage with. We are still building those out. So if you go there and you're like, ooh, I want to learn about this. Oh, it's not there. Send me an email and I can make that a priority to get that developed or find what I can about that. And we can add in those tools on demand, I guess, or as needed. Otherwise, we are working to fill it out more fully as well. Thank you. So as I mentioned, we use national frameworks. These frameworks include foundational principles, quality standards, engagement strategies, and evaluation and assessment approaches. So as you can see, we have the name of the framework, key content for it listed out, as well as the components, like how that affects the framework and how we follow it. All right. So as I mentioned, we are still developing one-page info sheets, and we do use the information from our discussions with families in those info sheets. We are also looking and finding tools that already exist that can help with this, and asking permission to use them, of course, because there are some great tools out there, but you have to get permission to use them. And if we don't find anything or we don't get permission, we can develop our own tool to fill that gap. So one of our goals is to have a fully accessible toolkit for anyone who's interested in family and consumer partnership. So you don't have to be in a program who's already doing it, or if you're just curious or just an individual out there in the state, you can access that information. Our second goal is we will be developing technical assistance to our community partners to help increase their engagement with the consumers that they work with. So, and also as always, with any of this work, if I haven't mentioned it before, is to review, listen, and make updates or changes as needed. So that's constantly saying like, well, we put this together, does this still sound right? And seeing where we need to change. Or if we hear feedback on how something's not quite right, getting that updated as well. All right, so I'll go ahead and talk briefly about our family leadership team. So this family leadership team was originally developed from the Preschool Development Grant, or PDG, that was awarded back in 2019. This group was originally formed in 2020. So our original structure was to convene 4 times a year, and those meetings were an hour and a half, and we were bringing together agencies, other groups and programs that work with families and families themselves. So now we are going to still be partnering with the agencies and groups and programs that serve families, but we are also looking at hosting roundtable sessions to get broader family information and feedback. So move forward. Yes. So the family leadership team, oh, it got moved. That's fine though. There's a little red box there that should be over a little bit, but you can see where it says the family leadership team on there. Anyway, it is written into the statewide governance structure under the early childhood recommendations panel. So the idea is that what we get back from families in feedback or that need to be actionable items that we can move up to either the recommendations panel, perhaps even the state director's team or the children's cabinet, depending on where that might live, to help move things along in the process. And then likewise, if like part of the children's cabinet or the state director's team or the recommendations panel, anyone wants to give families something they want to ask, we can bring that to families as well. So it's a nice back and forth. And KDHE has been a part of developing this larger family agency and program feedback and action team, which is a lot of words, but our main goal is that we're hearing from people throughout the state who are living in the state, not just focused on the MCH work, people who are raising their families, people who we want to hear about their available resources or services and their supports, the good, the bad, the what works amazing that they'd love to see more throughout the state, because none of our communities across Kansas are uniform through the rural and the urban and just regionally. There's a lot of differences. So our second goal is we will be compiling feedback to create smaller work group projects and to produce a solution. That way we are showing consistency. All right, you can go to the next one. I think I'm jumping ahead of myself. Okay, yes. So our newer model that has been developed, and we'll get to talk to you more about this next month, I believe, as well. So when we talked about getting together 4 times a year for an hour and a half to hear all those things from families, we realized that's not enough time to really listen to all of the things and to have any sort of action in it as well. So we actually just hosted in partnership with KUCPPR some roundtable discussions where we asked some questions and got some really great feedback that I haven't heard what it is yet. So I'm looking forward to that. But the goal of those is that we'll host those periods where people throughout the state can come and engage and give their feedback. They don't have to commit to being there every 4 months for X amount of time in the middle of the day when it works for other agencies. But we will be using their feedback to create formal recommendations. And that way we can actively show the power and the value of the family voice and how to partner with families for other agencies. So it works like we have a question, like, what do we want to know about? So we can go and ask families. And then we'll take those notes and compile the feedback. And then we can kind of see what we can tackle first. So divide and conquer. And then one of the very most important steps to this whole process is that we bring it back to the families and we say, this is what we heard you say. This is what we're going to do about it. Does that sound right? And if they say, yes, that sounds amazing, or that sounds great, wonderful, then we can move on with it. If they come back and say, well, that's not what we meant this other thing, then we get to go back to the drawing board and try to get it right the second time. All right, we can move on. So the very most important thing, as I said, is creating that transparency of, we heard this is where this is going. And so that they can see the steps to progress and they don't feel like they're just coming and talking to us and we seem like we're engaged and listening and then we do nothing about it. So it's a lot about building that trust and the partnership for the general public and with state programs and agencies as well. So, and then through doing this, we're hoping to bring in more agencies that can have the opportunity to gain feedback from families and then also maybe be encouraged to take on more of an engagement role themselves. Um, all right, well, I guess if you have any questions, I can do my very best to answer them. Otherwise, you can always email me at cora.unger@ks.gov. And thank you.
Yes, if there are any questions that any of our viewers would like to ask right now, you can utilize the chat. We do have a thank you for acknowledging the need for childcare meetings to be held online, that this was the first time that they heard somebody say that. So
Oh,
we appreciate the online work that you are doing to help families stay involved.
yes, thank you.
I am not seeing any additional questions in the chat, so I just want to thank Cora for her time today, for discussing these consumer and family partnership options that we have in Kansas, because they are so important to the system themselves. So thank you so much, Cora. We appreciate you.
Thank you very much.
Moving forward, I am just going to give you some early childhood systems updates. We're definitely not going to keep you for the full hour today, so we will give you some time back. But first, we'll give you these updates. The Capital Projects Fund Accelerator is still going on. There is a second round happening. This accelerator is offering construction-only grants to expand on the state's efforts to create those new licensed childcare slots while adding space to enable work, health monitoring, and education supports. So currently there is a technical assistance webinar that is available for viewing at any time on the Children's Cabinet YouTube channel. So I would advise anybody who wants to apply for this accelerator grant to go to that technical assistance webinar on the YouTube channel and give it a watch. It can potentially answer any questions that you might have. The request for proposal is out. And as I said, technical assistance is available and the applications are on the Kansas Common app. And this second round is going to close on December 18th. So you've got a little over a month for that. And if you'd just like to learn more about the Capital Projects Fund Accelerator, you can do so by going to the All In for Kansas Kids website. All of those links that you see on your screen will be dropped into the chat in a moment if they haven't already been. Moving on, through the Kansas State Department of Education, the Healthier CACFP Award is the Healthier Child and Adult Care Food Program Award. That is a recognition system that supports the wellness efforts of child care providers, daycare center staff members, and home providers that are participating in the Child and Adult Care Food Program. Caregivers going above and beyond the program requirements by taking steps to improve menus, physical activity, professional development, nutrition and wellness environment, and or infant care can apply for an award in one or more of the categories. The three award levels that are offered, as you can see, are honors, high honors, and highest honors. So you can find more information and you can access the application and the resource book by following the link in the chat, or you can email Karen Seymour of KSDE at kseymour@ksde.org. Next, Greenbush Family Connect modules. As a part of their All In for Kansas Kids quality sub-grant work, Greenbush has the Family Connect modules, which is a series of 8 one-hour interactive modules that are connecting families to resources and services to promote the healthy development of children ages 0 to 5. You can see on the right side of your screen all of those modules. 3 new ones just became available recently. There are stipends of $25 available at the end of each one of these modules. And to access those, you can follow the link that will be placed into the chat. Our Kansas Parents as Teachers Association monthly training series is still going. This monthly training series is for teachers and educators, and all of these trainings are free and available to all current Kansas Parents as Teachers Association members. If you are not a member, that link will be placed in the chat. And each month is going to feature a different topic that is relevant to early childhood and family issues in Kansas. So as you can see, November, they're talking about racial equity. December is autism within families. January, prioritize play. And February is about intimate partner violence. And as we go through the year, there are more trainings, as you can see on the right side of your screen, but very important to stay educated on all of these things. Usually we show you early childhood conferences, but the 2023 season of conferences has wrapped. So shortly we will get you the 2024 schedule as those conferences pop up. But reminders and next steps for all of our upcoming meetings. Our children's cabinet meeting for December is going to be that first day, Friday, December 1st from 9 to 12 p.m. We have our early childhood recommendations panel meeting that is taking place this Friday, November 17th from 9 to 11:30 a.m. And our next early childhood systems building webinar will be held on Wednesday, December 13th. As always, you can find all of these meeting recordings on the Children's Cabinet YouTube channel, and some of them are also live streamed the day of. So you can find that on the YouTube channel as well. As always, you can continue to stay up to date, like I said earlier, by signing up for our All In for Kansas Kids e-newsletter. You can also follow us on Twitter, or you can subscribe to our YouTube channel. That is all we have for you today. So like I said, we'll get you out of here a little early, give you 20 minutes back in your day. But I want to thank everyone for being here and giving us your time, and we will see you in December.